Bismillahirrahmanirrahim. I am Dr. Mohibullah Wazir. We want to talk about the nerve supply of intestine, the third lecture. Okay, I discussed the nerve supply of esophagus, and then I discussed the nerve supply of lower end of EAT, that is the anal canal. Then from the mid esophagus to the proximal part of the anal canal, the whole of the GIT is supplied by plexuses of nerves, and these plexuses are formed by sympathetic and parasympathetic. And from these sympathetic and parasympathetic plexuses, the nerves reaches to the stomach, to the small intestine and to the large intestine through along with the blood vessels containing these branches from the plexuses contains both sympathetic and parasympathetic fibers. But note, present inside the wall of the intestine, there are two, again inside the viscera, inside the wall of the viscera, there is two plexuses made up of nerve cells and nerve fibers. These plexuses, one plexus is present in the muscular wall of the intestine, that is called as mentoric plexus, and one is present in the mucosa, which is called as Wazir plexus. Combining, that is called as enteric nervous system. Note, the sympathetic and parasympathetic which reach to the intestine from the plexuses, for example celiac plexus and other plexuses, it first reaches to these mentoric and Wazir plexuses, and then through these plexuses, then these fibers then reach to the muscles and to the glands and to the mucosa of the intestine. Now note the point. The Wazir and mentoric plexuses, these are being stimulated by sympathetic and parasympathetic, and you know sympathetic is motor and secretomotor for the smooth muscle for the glands and inhibitory for the sphincters, while the sympathetic is motor for the sphincters and sensory or afferent for the viscera. But if you cut the sympathetic and parasympathetic supply, the Wazir and mentoric plexuses, they can work by itself without the extrinsic fibers coming from the sympathetic and parasympathetic fibers as well. But if you remove the mentoric plexus from the intestine, and the sympathetic and parasympathetic fiber that reach to the intestine and directly go to the smooth muscles, the smooth muscles will also work. Note the point. But the purposeful and coordinated movements, as it occurs in the peristalsis or in segmental movements of the intestine to push the bolus forward, this is only possible if the sympathetic and parasympathetic, it comes to the muscles of the intestine through the mentoric plexus. Then mentoric plexus intervenes, it reaches the mentoric plexus, stimulate it, and then the coordinated and purposeful movements are then possible only at that time. Okay, then the plexuses which supply the intestine is number one, the celiac plexus around the celiac ganglion, which is spread along the celiac artery just below the diaphragm, and this plexus is being fed by the splanchnic nerves that descend, greater, lesser and less splanchnic nerves that descend from the lower thoracic sympathetic chain. It reaches over here, and then these sympathetic fibers are joined by parasympathetic fibers coming from the vagus, and then the celiac plexus is formed. From this, the branches then containing both sympathetic and parasympathetic are distributed along the blood vessels to supply the visceras all around the stomach, the duodenum, jejunum, and small intestine, the gallbladder, and etc. up to the proximal two-thirds of the transverse colon that is supplied by the vagus and these sympathetic plexuses. Now the sympathetic plexus are the celiac plexus, then the small renal plexus, then the aortic plexuses, and then the superior hypogastric plexus, and the superior hypogastric plexus divided into right and left hypogastric plexuses, and then the right and left hypogastric plexus then are joined to the lumbar sympathetic nerves and lumbar sympathetic nerves to join the inferior hypogastric plexus. The inferior hypogastric plexus, which is joined by the sacral parasympathetic nerves, and from the lower lumbar sympathetic that supplies the distal part of the transverse colon, the descending colon, the sigmoid colon, and the rectum, and the proximal part of the anal canal, and the contents of the pelvis like the bladder and the uterus, etc. In this way, the celiac plexus, the renal plexus, the aortic plexuses, the hypogastric superior plexus, in inferior hypogastric plexus being made by sympathetic and parasympathetic, this supplies all the abdominal viscera. And then I think in this way the 4 lectures about the intestine, the nerve supply of intestine, you all listen, you will become very clear once for all. Thank you very much.